Welcome to Aging in Kentuckiana, where together we discuss proactive aging in the right place with a choice, connecting to the professional advice of our special guests while creating better days through the aging process. Aging in Kentuckiana is presented to you by Comfort Care Louisville East, a leading provider of home care services in the Louisville area. The caregivers of Comfort Care thank you for allowing us to serve and provide loving care for mom and or dad as they proactively age in their place of choice. And now, your host of Aging in Kentuckiana, Kim Gravenkemper, and Chris Prentice, owner of Comfort Care Louisville East.
Good morning, everyone, and welcome to Aging in Kentuckiana, the area's only radio show that is dedicated to proactively helping our senior population as they proactively age in their place of choice, whether that's in their home or in one of the communities. Each week we have an in-studio guest that is an important part of the puzzle that answers a lot of questions that families have. And today is going to be another great show for us, Kim. We've got two young ladies in with us that almost started the show with us last year.
That's right.
We're with, and so I'll let you do that introduction. But before we do that, I want to give a special thanks to our corporate sponsor, Comfort Care Senior Services and Comfort Care Louisville East. The caregivers of Comfort Care thank you for allowing us to love and care for your mom or dad as they proactively age in their place of choice. Also, if you miss any or all of our show today or any of the other shows, we archive those on our website. That's www.aginginkentuckiana.com. Again, that's www.aginginkentuckiana.com. Kim does a great job of keeping that website up, and we also have community events that are listed on there as well. I'm going to go ahead and bring you in, Kim. How are you?
I am peachy. How about you?
I'm doing well.
Good.
Fighting a little bit of a cold.
I can tell.
Shot my mouth off on Monday, telling people I'd never get sick. And, I decided I'd go ahead and prove myself wrong.
Okay, well, you need a doctor. I've got the right one.
Yes, you do.
They're sitting right next to me.
Absolutely. But anyway,
okay,
it's all yours.
With that said, I'm excited that you all are returning with us. I think in this year, you were our second guest, I think, and so in this year, we have learned so much, and so we have come full circle. So Kim Cashion and Pam Alvey are with us with Extended Care ECHousecalls. So welcome back, ladies.
Thank you for having us.
Thank you.
We are so happy to... and I keep saying that I'm so excited about this show because I feel like in this year, not only myself have learned and spoken, Chris and I have spoken with so many guests, and we see now downfalls or gaps that are lagging in between transitioning care with loved ones. And it started, I think, for Chris and I, because that was such a issue for us with our loved ones. And so now it's having you all with us again is really fulfilling, I guess, our hope for connecting everybody.
Connecting the dots, so to speak.
Exactly.
You know, and everyone in the industry do a really good job. It's that going from one segment to another where the handoff is
right. It's a poor handoff,
can be a little bit
exactly
more graceful.
What it is.
Okay.
So let's talk a little bit about your company. If guests want to hear the first, like I had said, the first show is going to be different from this one because this is saying specific needs and in areas that we're helping with, and then it's also going to say what you do in the community. So tell us a little bit, either one of you, about your company and what you all do. In general, and then we're going to go dig into the more details.
The nitty-gritty.
Okay, I'll start and I'll let Kim add in. We're doctors and nurse practitioners that take care of patients at home. Like you mentioned, patients want to stay home. They don't want to go to the hospital. They want to stay in their home or their community. And that's where we come in and take care of them, and we help fill those gaps, right, which I know we'll talk to you about more. But when patients go to a hospital and they go home, medicines are wrong. They don't do the right therapy. They don't get an assessment. So that's where we come in and help. It takes a village, and it's not just us. It's medical, it's non-medical, it's specialist, it's all of us. But we help. We're kind of the ringleader, if you will. We help.
Quarterback.
Yeah, we're the quarterback. We are the ones that are to oversee everything, to make sure it's all being followed up. Don't you think, Kim?
I totally agree. I think medicine's moving back to the home. We have an aging population. We have a population that can't get out to the primary care office, so we're taking all of the mobile and ancillary services to them. And also, no one wants to have to go into a community or facility, but it is warranted in its certain appropriate places. And then it's just about connecting people to one another, communication.
The communication is the biggest. I think that's the biggest thing that we need to talk about today, because it's huge, your services that you provide, but without the other people helping in that continuum of care, or the whole care plan as a whole, I think we work with so many different people, like you had indicated, and I think that's the huge thing. And making sure that people are informed. So I think that's a big leg as well. I think people leave hospitals and leave doctors' offices, and they leave it. And there's no other communication, there's no other research, there's no information that's being portrayed to them. And so that's where you all step in. And go ahead.
We talk to a lot of families. They'll call in and say, Mom or Dad was in the hospital. And they're like, I'm here with Mom and I don't know what to do. I've got this list and I don't know what to do. And they were probably told what to do. It's a lot to take in. How can you remember everything? It's a whole list. So how can you remember? So when we get the phone call, it's like, it's okay. I'm going to take care of it. One call. I'm going to get a doctor or nurse practitioner out there. We'll order home health. We'll order non-medical home health. Do they need other things like a CPAP machine or an IV fluids, or do they need catheters? What do they need? Or they'll go home with a wound with no supplies and they're not sure where to get them. That's where we come in. And it's not that they weren't told. It's just, it's too much to take in.
Or they take home those packets.
Yeah, and they're huge.
Like, who's going to read that?
Yes.
I mean, it's nice to have, and it's great that they provide it. The funniest is when we'll leave a doctor's office with my dad, and she'll give us almost a binder full of information, and they'll joke about it, and they'll say, here you go, we have to give it to you. You know, read it when you've got something else or nothing else to do. And I'm like, okay, seriously? Like, so that is amazing. You all it's a one-stop shop.
Yes.
Because if you can't help them, you will get the service, that can. So,
well,
great. Quarterbacking, I say. I love it.
It's a situation where a lot of times I meet someone and we exchange names, and immediately I forget their name. I remember their face, but it's the same type of thing. They're nodding their head in agreement that they're receiving the instructions and they're hearing, but they're not. It's not being retained. Mm-mm. That transition to care is a term that's out there, and I know that hospitals want to ensure that the transition to care is as smooth as possible, because they've got there's some reporting requirements, and we're not going to get into that. However, just the fact that if a patient ends up back in the hospital for the very same thing within 30 days, there's a penalty that, and so the reason why the penalty's there is not for someone to collect a penalty. It's to ensure the importance of making sure that the patient doesn't return to the hospital within 30 days for the very same reason they came in the first time, right?
Correct.
And you're a part of that transition of care,
yes,
continuum, if you will, right?
Yes. Our goal is that patients are seen within 48 hours of going home. And we collaborate with the medical team, meaning the home health agency, to get a nurse out there as well within 7 days. So within 7 days, our goal is that they are seen by a provider, meaning a nurse practitioner or physician, as well as a nurse. There are some patients that we have to go out and see twice a week, depending on their needs. So yes, we will go as often as needed to keep them out of the hospital, because that is the goal. Everybody's being penalized when they're going right back.
Right.
I think it's important to say, too, that in the hospitals, it's not that they don't, they're busy, and they are needing someone like you to be that bridge for them, because a lot of times they're busy. They don't know who to refer, and they're not going to refer anyone for oxygen equipment or medicines or things like that. And so sometimes I think they just release the patients, and if you're not involved with that, that's what we're talking about. So people need to be informed and know when you are leaving the hospital, you need to do your due diligence in getting that information and finding out what your needs are, or your loved one's needs, before you even leave. So,
And we can help with that. That's
Right.
all they have to do is call us, and
that's it.
Walk us
call.
through an example. I'm my dad's in the hospital. He's getting released, and we know that when he gets out, that there's he's going to need some sort of care moving forward. Now, is it at that time of discharge that I should engage extended care house calls, and who tells me that you're the one for me? How do I make that happen?
Well, hopefully the hospital would refer you to us, and then you make the call. You should call the day Dad goes in. It's sooner we can get the process started, the better.
Okay, so when he goes in the hospital.
Absolutely. Yeah, don't do it after the fact, and don't get him home and then try to rush to get us there. Get us there, and then what we do is we coordinate with the case managers. If it's a nurse or a social worker, we coordinate with them. We verify the insurance, we get the records, and then they will tell us when Dad's going to be discharged. And then once we know when Dad is discharged, we actually have a referral team that will call you and spend as much time as needed on the phone and explain this entire process, explaining how we work when we come, what to expect, and what to call us for, and when to call us. And then we coordinate with your home health and your medical team and your non-medical home health. And we coordinate with them and make sure that everybody is in place and being seen and being followed. We review the medicines, if any equipment's needed or any supplies are needed. And what if Dad gets sick again? Totally different situation. What if Dad gets sick, gets a cough, and he was in there for a wound? We can take care of that so he doesn't go back to the hospital. So we coordinate with you to teach you, call us and call us only, and then we will coordinate the rest of it.
Right.
And
I'm going. We're up against the break, and so we're going to spend more
on
time.
that, right.
We really need to spend more time because you're just hitting on the most important thing, and I say that, but.
They're all important things.
I see a lot of things here. And I said we're up against a break, and then I keep on talking.
That's right.
You're listening to Aging in Kentuckiana on 970 AM, The Answer.
Now, back to Aging in Kentuckiana on 970 AM, The Answer.
Today with us on Aging in Kentuckiana, Chris and I are speaking with Pam Alvey and Kim Cashion with Extended Care House Calls, and we touched on the gap, and that's what I think most of the show is going to be, but it's connecting people and informing people, and I think that is just critical. So before we stepped away, we had talked about the gap with the hospital and people leaving the hospital, and how important it is to contact you all when they're admitted into the hospital or when they go to ER or whatever the situation is. It's important too, like you had indicated, and I think then we can talk about that as well, is communicating and having you at the first sign at home with an illness. So
one of the things I'd like to say, not only do we market to the community, but the hospitals who we closely work with, as well as the primary care practices. We are and have been getting more and more referrals from them to recognize the patients they already have in their practice that are homebound. So if we can get on the case at that time, or even when they're in a transition from having had a stroke or anything that causes an impairment that they cannot get back or back to their primary care physician, we can follow them and help them recover at home.
I mean, that's huge. You know, the biggest thing that I'm seeing in this industry is the people that really get it don't see it as a competition among people.
No, not at all.
Anymore. It used to be. And now what you just said is huge. You are working with primary care physicians. Technically, that's what you all are,
yes,
except your primary care physicians that go to the homes. So you are assisting these doctors, and there again, filling those gaps between that as well.
Why would you want your loved one have to go through a hardship of being drug out into the open, and it causes pain or shortness of air or suffering just to get to an office when we could have been to the home and taken care of whatever their need may be?
Exactly. So it's just communicating. So let's talk a little bit more about. I want to talk a little bit more about when a patient leaves the hospital. Let's talk a little more about the services that you touched on it, but let's really tell people, like, you can literally take an X-ray machine
Yes.
You monitor their medications, you order their medications,
Yes.
you are their physicians at home.
Yes.
So let's expand a little bit more on that.
What can be done in an office, we can do in a home, and plus more. And we, like you mentioned, x-rays, ultrasounds. We can even do DEXA scans in the home. We can ultrasound joints or the heart. We can do EKGs. We can do IV fluids. We can do IV medicine. We can do life vest, breathing machines, ventilators, if you will, without the tube. It's Trilogy machines, CPAP, Astral,
and the Trilogy, the non-invasive ventilators.
They're at wound supplies, tube feeding. What else is there? I mean, it's endless.
Draw blood.
Yeah, a blood work, urine.
Like I was thinking about that as well. Like you can do blood samples and things.
We work with delivery pharmacies.
Okay.
Because medication error is the number one reason for readmission. Right, that's the problem.
Right.
That's one of the biggest problems. So we, along with the home health team, will go in and verify the medicines. Well, they can't get them. They can't get out. The children work. They have their own children to take care of. So we work with delivery pharmacies to get medicines delivered to home, as well as nursing to help us manage the medicines to make sure they're taking them the right way. Well, then we find out that mom or dad can't see that well or don't remember to take their pills. We can get pill planners, get that put into place, and medication monitoring. Or they'll go home with a new list of medicines, new medicines all in front of them, and then they go to their cabinet and start taking old medicines with new medicines, so they're double dipping and taking 2 heart pills that they shouldn't. Heart rate goes down, they fall, break a hip, and end up back in the hospital.
Exactly.
That's what we prevent.
Right. I think the thing that folks don't really realize is the fact that a lot of like my general physician, our principal care physician, he may not be allowed to go into the hospital. So he may know me from all the visits I go to, but once I go into the hospital, there's a different set of doctors that are on hand and are going to take care of me there. So the way I envision this is while I'm in the hospital, you guys come in, you understand what the care plan is while, one, I am in the hospital, but also how that care plan is going to be in place when I exit, and then you can really you can establish the non-medical, the medical, home care, the whole 9 yards. So if the hospital physician says we need to have physical therapy, then when they exit, you're involved and you can order the physical therapy. You're in essence the in-home doctor, correct?
The quarterback.
You are the quarterback.
There we go.
Well, you may be the coach too.
Absolutely.
You're the main. You're the main. You know, you've got to think of it as if whether it's a circle with you in the middle and you're connecting everybody in that peripheral, if you will, to make sure that the best care possible is in place for mom or dad, right?
Yes. We even reach out to all the people you're talking about. Say they're seeing a cardiologist or a kidney doctor or a lung doctor. We will reach out to them, call them, give them our assessment, tell them what we see, get any suggestions, and say, hey, we'll get them back to you once they get better, so they can still see us and their specialist. But once they can't, the specialists, they're so wonderful. They love us. They thank us for taking care of them. And they're like, call me anytime. I'll help you treat Mrs. Smith. I've known her for 20 years. They do not mind that at all. So it's teamwork, working together.
I'm here to attest to that. That's one of the biggest reasons that I said they need to come back on, because how many specialists, Chris, have we had on now in this year that have said the same thing over and over? And it's because not that people don't have a primary care physician. It's just they can't get out, or they can't get to them, or they have their loved one that lives out of state. And so, you know, their physical health might not be there. So they have said that over and over again. And so that is the gap, again, that we're trying to fill.
We even have many veteran patients that we can still see them at home, and they can still go twice a year to keep their benefits because they're homebound, they're aging. And we can take care of those needs and coordinate with the VA just like we do any other patient.
They've been wonderful to work with, too.
Absolutely.
Yeah.
Dr. Krishnasamy works with the veterans down there too. She was our last guest as far as a specialist that has said that it's so important for people to remain with a physician in that continuum of care. She will see them for the specialty issue, and then you all just provide that support.
Right. I just see where the need for you in the hospital is. I mean, I don't see how you're not in there.
Right.
It seems like you're there. You have to be there almost every day, correct?
Well, they just call us,
Right.
and we coordinate the care. So our biggest referral source is the hospitals. They're like, okay, Mrs. Smith's back in here. This is the 5th time. We need you guys. We've made 5 appointments for her to see her PCP or her specialist. They didn't show up. So, and it's because they can't get out. It's not that they're non-compliant. It's just difficult and it's hard.
I love they call you though.
Yes.
Like that's the thing. They realize you're there to help.
And then the home health is our second biggest referral source. And then third is the PCP. We are starting to get a lot of phone calls from them. She can't make it in. Please, can you all take over the care?
Right.
Love it.
That's incredible. Okay, we're gonna Kim. We're up against the second commercial break, and I think that we're really learning a lot. And you know, I think everyone's got to realize that Pam and Kim did a really good job of getting their previous show posted so that it was accessible to people. And the same thing will happen. But folks, you really gotta be aware of extended care house calls for mom or dad. They can really help you through navigate through the tough water, so to speak. Well, we're going to go ahead and take that break. When we return, Kim's going to dive into some more important discussion topics with Pam Alvey and Kim Cashion with Extended Care House Calls. You're listening to Aging in Kentuckiana on 970 AM, The Answer.
You're listening to Aging in Kentuckiana, where together we explore options of aging in the right place.
You are listening to Aging in Kentuckiana on 970 AM The Answer. Today with us, Pam Alvey and Kim Cashion with Extended Care House Calls is telling us why we need their assistance. Bridging those gaps between whether it be incomplete information transfer from hospitals to doctors' offices, they are the one-stop shop. I think we need to talk about next the fact that there is probably a deficiency in a point of contact a lot of times. You've got the loved one who is caregiving for their loved one, and a spouse, I should say, that is caring, or a son or daughter who may or may not be in the same city. And so there is that gap as well that I think is important to talk about, and how you all bridge those gaps. So how do you go about doing that?
Well, our referral process is ever expanding, and we have learned a lot in the 2 years since we've expanded into the house call arena, that it's very important up front to give multiple ways to communicate to us, not only to our medical assistant, but through our provider and our main office phone number. We give them phone numbers, we give them fax numbers, we give them emails. But we also explain what we do and how we can do it so that they know up front. And, you know, the stress is very high with someone at home. And you've got a caregiver. I'm a caregiver myself with a family member at home that is aging, and your stress level is so high you're not going to remember all of this when the provider hits the home. So if we do that up front, when we're making that appointment, let them know everything that we do, that we're a primary care practice. We can bring all of these services to the home. We can determine if they have a living will. We can determine their goals of care up front. What are their expectations from us, and what do they expect from us as well? And also have those medications available for us to review when we hit the home. It just reduces so much stress on the caregiver, because many times they're not able to be there. And we also leave visit summaries with them as well.
Just to elaborate, as soon as we know who the provider is going to be, because everybody has zip codes, so you're not driving all over town. So as soon as we know who that provider is going to be, the referral team calls that family member or the patient and says, here is your doctor or nurse practitioner's cell number. Here is that medical assistant's cell number. Here's their emails, and our main house call email is seen by every staff member in the company. So somebody will see that. So they have 3 numbers, 3 emails to get a hold of us. And like Kim said, we take that time because this is special. It's not just like calling the doctor's office and making yourself an appointment and then you drive in and see your doctor or nurse practitioner.
Right.
This requires special care and attention, and then that's what we do. We'll spend an hour and a half on the phone answering their questions. Like you said, some of them are in Hawaii.
Right.
Guess what? They can be very involved with their care with us.
And I think the inadequacy. I can't believe I just did that. Inadequacy of the information that is given to them. I guess the loved ones is, that's the big thing is they're not getting enough information. And I think also the limited access to services. And they don't know what they can have until they talk to you. And it's just, like I said, a one-stop shop.
We have revised our new patient packet, and that's what basically our referral team is going over before the providers go over it with them again in the home setting. And one of the forms is what to do and when to call. How do we know if mom has a cough, if mom has a fever? What do I do? Because we are a different service. We will adjust those appointments. We do acute visits, we do maintenance visits. We just explain everything in detail.
I think one of the things, also that people need to realize that home can also be the many communities in the area, the personal care or assisted living or the memory care. You can be, that's home. That's home for them, and that's also home territory for you as well, correct?
Yes, and we actually teach them, we don't want you calling the facility, you call us. If mom or dad were at home, which this is their home, who would you call?
Right.
Nobody in the home, you're going to call us if there's a problem. I don't even want them going to the nurse or anybody. Call us. Somebody is on call 24/7. Either a physician or a nurse practitioner is on call 24/7. So they can get to us. Plus you have the cells. Plus you have our emails. We also give them access to our electronic medical records so they can see our progress notes. They can even communicate through us in our electronic medical records. There are so many ways to communicate with us. So
that is such a good point.
Now, the on the personal care, the communities that are licensed as or certified as personal care, they have nurses on staff. You can interact with them too, right?
Yes, we do. Yes.
Okay.
We call and give them orders, but we would rather the daughter or the son or the patient ring in their bell to get the nurse to come in, telling them they're the complaint, and the nurse calls and tells us. We would rather them call us than we call the nurse back with orders. Okay,
but it's still okay that if they ring their little bell to get the nurse, because you want immediate care.
Absolutely.
And that's what they're there for, but they need to be especially trained to understand that, hey, give, just like any other physician, I guess, but give Pam and Kim's team the call.
It's probably the hardest thing, right? I think it's the hardest thing is just getting people to understand that you are their primary care physician because they think this is so easy. Like, how can it something so easy and so good be? But it's true.
Right. And I think that, the landscape of the medical profession is ever changing.
Right.
And these guys are on top of it, that's for sure. We're going to go ahead and take another quick break. And when we come back, we'll start wrapping things up with Pam Alvey and Kim Cashion with Extended Care House Calls. You're listening to Aging in Kentuckiana on 970 AM, The Answer.
This is Aging in Kentuckiana on 970 AM, The Answer.
Welcome back. And today we have with us Kim Cashion and Pam Alvey with Extended Care House Calls. And Chris and I have been really touched by what you all have accomplished in your couple years in business. You have definitely enlightened us to services. On your first show, I think we talked about it a little bit, but now it's just, like I said, it's come full circle. And we see so many people who are in need of this and don't know who to reach out to. They see the gap in health, in the health of the declining health of their loved one. They talk to him on the phone or they see him daily and know that there is a need for them and they can't get out. And so you all are the ones that they should contact. I think it's important to kind of talk about your employees and who answers the phone when we call, and because you all have such a compassion for what you do, and I know that you instill that in your employees as well.
Yes, we have an amazing team. This company is just not mine, Kim's, and Dr. Nair's. It is the entire staff. Our staff is wonderful. We have Natalie, who is our referral manager, but then Casey is cross-trained to do it as well. Tina, who manages our narcotics team, she's cross-trained to do it as well. Then we have the medical assistants who answer the phone. We have Jackie and Casey and Becca to answer the phones as well. We have Abby, who is a nurse that we just recently brought on with us, and Nikki, who has worked her way up in the company and she's a scribe with Dr. Nair when he rounds to see patients. So everyone, if you were to walk in and ask them what they thought about their position, their title, their job, they would tell you it's the hardest job I've ever had, but it's my favorite, and I love it, and I'm not leaving. And I'll say, whose company is it? And they're like, ours. And it is our company. It's all of us. And our patients are special. They require that special attention. Again, it's not a PCP that says, here's your business card or here's your card for your next appointment. No. We sit down, we leave notes, like Kim said. You have access to records. You can call us anytime. Kim and I, if somebody does not answer the phone, it is myself who gets paged, then it's Kim, and then it's Dr. Nair, the three owners of the company. That's the way we work. And then not only is it the front office staff, it's the staff out in the field. We have 11 clinicians, we have nurse practitioners, 2 physicians, and a physician assistant. So, and they're all compassionate or they wouldn't do this. And we're very blessed. And I just feel like our office, our company is changing medicine, which it needs to change.
Absolutely.
And we need to communicate, and we need to provide better care for our patients. This is the most difficult population you could take care of. And that's what we're doing, and we just feel that God put us here to change medicine, and we are.
Daily. And I think it's important to also mention that you've got a great team, and then you also have a great team in the community. In different companies. I think we talked about that a little bit too, but you work so closely. It shouldn't be, nowadays people in this industry are so compassionate. I mean, I see myself just in doing this, and Chris is the same way. Like,
right.
We just feel like it's so important to connect people with each other. It's not about the monetary value of things. It's about people, and it's about creating those bonds and creating the best care that we can possibly do. So I think
one of the other things that I wanted to ask you is a situation where mom or dad still is living in the house, and you're called in as part of the care plan upon exiting the hospital. It's realistic to expect there'll be times when you see someone that maybe shouldn't be going back to their home per se, and maybe going into a community. Walk us through how that may play out, because I know a lot of families don't really know much about the various communities, whether they're personal care or memory care or assisted living, so on and so forth.
Yeah, that we are in all the areas. We're home all the way to skilled nursing. So we can follow them through that process. So when we do see a decline, like Kim said, we set up from the beginning, what are your goals of care? If and when they do decline, what are our next steps? Where are we going to go? Well, we might need to transition into an assisted living and then to a personal care. And we can help transition that. If the process becomes a little more difficult than us just sending the referral, we do work with other agencies that place patients. And it's a wonderful process that they do. It's very detailed. It's labor intensive, but those are the companies that do it, and they do an amazing job. But we like to keep the patients with us, because one of the things with aging and dementia, change worsens the dementia. They get more confused, but they can at least keep that same provider. And that familiarity is just amazing. Right. So yeah, it's a great process.
So again, it doesn't matter whether they're going to their residence or they're going back into a community. You can still be involved, and that's the important thing. I mean, I hate for people to have the thought process that, we got to use them when we were going back to our residence, but do we lose them if we decide to place mom or dad in a community? And the answer is no. You go into the communities as well, correct?
I'd like to piggyback that. We also can follow them through end-of-life care with hospice. If they don't go to a community and they do begin that transition, we can still remain attending on the case and help coordinate the care. So whether we get them to a higher level of care because they're failing a lower level of care, we can end life with them.
Yes.
Right. Well, it's
with dignity in their home.
Exactly, wherever that is.
Yeah.
Well, again, it's so wonderful, and I think off the air I shared with you guys that my primary care physician was just discussing with me during one of my visits that Chris, there's going to become a time when doctors like myself aren't necessarily going to be around. It's just the way that the medical model is moving, and so you have to stay on top of it. It's ever evolving, ever changing.
Well, it is, and I think too it's important to say that I think that seniors become vulnerable as well to, I guess, lack in care or the way that they're used to living and not wanting to go. So the transition, you all with your transitional care approach, I think is vital. I just think
right. It's okay, it's okay to, once you're aware of the opportunities that are available to you, there's no excuse
exactly
not to be able to have the very best care in place.
And be proactive and learn and just...
Yeah. With all that said, can you all share your vital information, contact information, or we can do that in our next break, whichever you choose to do. We got plenty of time.
First of all, we have a website, www.ECHP2U.com. You can just Google Extended Care House Calls. We should pull up. We have a phone number, and it's our primary main contact, 502-356-4377. And we even have an email, housecalls@ECHP2U.com.
Excellent. Okay. So there's the contact information. And we'll give that back out to you again on the final segment here when we return. You're listening to Aging in Kentuckiana on 970 AM The Answer.
You're listening to Aging in Kentuckiana, where together we explore options of aging in the right place.
This has been Aging in Kentuckiana on 970 AM The Answer, and we have been fortunate enough to have with us Kim Cashion and Pam Alvey with Extended Care House Calls, a primary care physician service that does everything, that quarterbacks and comes to you all in your home. And one thing that Pam or Kim wanted to mention was insurance, and then your community involvement as well. So go ahead and take it. So insurance.
We accept most major insurance carriers. Give us a call, again, at 502-356-4377. We do accept some private pay. Our services don't vary based on the insurance that you do have. We will verify that eligibility immediately. We expect that to be completed within 45 minutes with our referral process. But again, you can call us and ask us any question.
The insurance approval, they pay us the same as if it was a doctor's office. So there's nothing special. There's no hidden fees, because that's another thing that people really ask. There's nothing hidden. And as far as community involvement, we are involved with the Kentucky Senior Living Association, as well as Go Red for Women. We are involved with the American Heart Association, the number one killer of women being heart disease and vascular disease. So we are very involved with that.
I love that. Yeah, I see you attend a lot of different things. I saw something on LinkedIn too.
Yeah, that was American Heart Ball.
Yes. Love that. That's
and
great
the
that
luncheon
you do that.
is coming up in May 31st, which I'm on the planning committee for that.
Right.
So it's a lot of fun.
That's nice.
Excellent.
I love it.
And
Just great people all the way around.
Absolutely. Share your website with us one more time, if you would.
www.ECHP2U.com.
Excellent. And of course, you can Google Extended Care House Calls, and it'll pop right up as well. Well, Kim, it was another great show. We were blessed to have Kim and Pam with us. It was about this time last year they were with us.
Exactly.
And, how quickly the year went by. But we won't wait another 12 months before we have you guys on again.
Although
okay?
I feel like it was, like I said, a full circle. It took us to see
Right.
just how valuable, not that we didn't know
We
that,
knew-
but
we
just
knew you
how
guys,
valuable and how you are the missing link in all of this, in healthcare.
Well, talking to the others, I think you could see their frustrations, which is
Right.
lack of communication, and that quarterback, which is what we are.
Exactly. And we knew it, but now it's
so
Now
we-
you see it.
now we see it.
That's what it is.
We see it. Now we
Exactly.
see it.
Our eyes
But
are
anyway,
open.
Thank you so very much to both of you for being with us.
Thank you for having us.
Thank you.
Kim, thank you for arranging Kim and Pam to be with us today. We're blessed to have the relationship with Extended Care House Calls. They can be anywhere and everywhere, and that's it's a blessing to know they're there to help us.
Right, and it's just to mention the website.
Right.
Theirs and any guest that's been on the show will be on our website, www.aginginkentuckiana. So if you want to call or if you have any questions with them today or any guest, you can visit our website under the schedule of guests. It would be listed under there, and their websites are attached.
But again, thank you to both of you for being with us, and Kim, thank you for getting that together.
My pleasure.
And we thank a big thanks to all of our listeners. We're on every Sunday at 10 a.m. on 970 a.m. The Answer. And if you miss any or all of a show, you can jump on that website, www.aginginkentuckiana.com, and you can listen to any of the shows, and you miss the commercials whenever you do that as well. So everyone go out and make it a great day. Thank you for listening.
Thanks for listening.
The preceding program has been a paid commercial advertisement.